I'd like to address the issue of chronic spinal pain after an injury. The medical profession and the insurance industry has a predisposed belief that every spinal injury case is going to get better within 6 to 12 weeks. And the reality is that there is no substantiation for that position whatsoever. There's never been a peer-reviewed article that backs that. And in fact, there's 90 articles or more at this point that substantiate back to the 1950s that people with traumatic spinal injuries end up having lifelong pain. Our firm is known for handling highly complex medical injuries after trauma. One of the injuries that we are recognizing more recently is cerebrospinal fluid leaks in the spine after an injury. As an example, the spinal column that surrounds the spinal cord has a fluid in it called cerebrospinal fluid, and it is generated in the brain, goes down and protects the brain and the spinal cord all the way down to your tailbone. The cerebrospinal fluid is kind of consistently being generated in the brain, shuttled down to the sacrum, and then being reshuttled back up into the brain. And I know all this because I used to be a doctor before I was a lawyer. So what we've realized most recently, though, is that with trauma, you can actually end up getting tears in that system between often the neck or the low back, and the cerebrospinal fluid is actually leaking through that. Now, not a lot of doctors know about it, but the substantiation in the science is there. If you have an injury like this, where you have chronic spinal pain, give our office a call or contact us by way of the website contact form. We'll set up a free consultation for you, and we'll discuss your injury and how we can best represent your interests.